Okay, so once again, good morning, students. So today we will be revising on the topic of superficial thrombophlebitis. So thrombophlebitis, if we like thrombophlebitis, what does it mean? Thrombophlebitis, it actually means some inflammation which are mainly caused in the veins. All right, which are mainly caused in the veins, and because of that, what usually occurs, there is blood clot. Okay, so this is the picture of superficial thrombophlebitis. And in thrombophlebitis, what will you find? In thrombophlebitis, you will find that there will be occurrence of two types of like abnormalities in the veins. That is, in the superficial veins as well as deep veins. Yesterday, we have already discussed deep veins. So today, we will discuss with superficial thrombophlebitis. And superficial thrombophlebitis, it usually occurs in the superficial veins. All right. And superficial veins, they are located where? They are located near the surface of your skin. Understand? Near the surface of the skin. And the deep veins, they are located where? They are located deep, which is within your muscle. It is located inside there. Okay, so now we will see upon the superficial thrombophlebitis. Okay, so this is superficial thrombophlebitis. It occurs in the superficial veins. Here blood clot occurs, and as a result, what happens? There is inflammation. All right, there is inflammation in the affected area. This is the affected area, so inflammation occurs. Why? Because obviously there is blood clot. It's not it, so that's why this usually occurs. So here I'm showing you the definition of thrombophlebitis. It is an inflammatory process which are mainly like uh, caused as a result of the blood clots. And the thrombophlebitis, it usually occurs in your leg area, okay, in your extremities, in the extremity area. So here are some of the symptoms of superficial thrombophlebitis. So first symptoms is that you will feel warm in that affected area. In the affected area, you'll feel that the affected leg, it will be warm and it will be tender. Tender means what? It will be sensitive. The area will be sensitive, the affected area. And because of the inflammation, what will happen? There usually occurs redness as well as inflammation will occur in the affected area. And also you will find that there will be pain in the limb. Okay, this is the leg. So this portion, it will pain. Why? Because of the inflammation. It's getting inflamed. Obviously it will pain. So that's why it will pain. And next is hardening of the vein. Hardening of the vein. Why? Because uh, since there is blood clot and the blood, it's like accumulating, it's pooling in one particular place. So that's why the veins, it will be hard. It will be hard compared to, this is the normal leg and this is the abnormal leg. Abnormal, which you will find in the superficial thrombophlebitis. So this is the abnormal one. So this is like because of the blood clot, what will happen? Like the vein, it will get hard, HARD, hard. Okay, did you understand?
Yes.
Okay. Okay, so now let's discuss about the causes and risk factors, like who are most likely to have this superficial thrombophlebitis. Okay, first is chronic health conditions. Maybe because of some conditions, health issues, the person might have this superficial thrombophlebitis. And medications. Because of some medications, the person can have this superficial thrombophlebitis. Next is immobility. Immobility means what? Like if a person stays in one particular place for too long, ultimately it will lead to this. Next is smoking, like having some tobacco, alcohol can also lead to superficial thrombophlebitis. Next is obesity. Because of overweight, the person can have this superficial thrombophlebitis. And sometimes it occurs in injury in the vein also. If a person is having any injury in the vein, all right, any injury, like say for example, any accident, any trauma, at that time the person can have this superficial thrombophlebitis because of the what to say because of the trauma, because of the accident that will happen. Obviously, the person will get affected, right? So inside, what will happen? Inside, obviously, there will be blood clot, and ultimately, that thing it will lead to superficial thrombophlebitis. And chronic health conditions like cancer, okay, all this can also lead to superficial thrombophlebitis. And some immobility, like what to say, like if a person is traveling in a plane or in a say, in any transport commodities like train, plane, anything. Okay, and for that reason, what will happen? It will lead to superficial thrombophlebitis. Is it clear? And elderly people also. For elderly people also, it's risk. They are at the risk of having this superficial thrombophlebitis. Okay. So here are some prevention for superficial thrombophlebitis. So since like a person is sitting in one particular place for too long, what will happen? The person will have to take a walk. Why? Because um, for uh, blood circulation. Okay, so that the circulation it will become rich. So for that reason, they should take a walk in order to prevent themselves and from not getting this superficial thrombophlebitis. Okay, next is drinking plenty of water. So since if a person will drink water, like what will happen? The blood circulation, like it will become thin, like the passage from where the blood passes, it will become thin and what to say? It will be easy for the blood like to pass thoroughly, to pass actively. So for that reason, like they should they should maintain they should maintain how like they should maintain like by drinking plenty of water in order to avoid dehydration. Okay, is it clear? Okay. Okay, if it is clear, then can anybody tell me what do you mean by thrombophlebitis? Pabuklang, can you tell me what do you mean by thrombophlebitis? Okay, then Vishal, can you tell me what do you mean by thrombophlebitis?
Yes, ma'am.
Thrombophlebitis का मतलब क्या है?
This. Mm,
वहाँ पे क्या होता है?
huh?
थ्रोम्बोफ्लेबाइटिस का मतलब क्या है? मतलब क्या होता है वहाँ पे?
That is.
इन्फ्लेमेशन है कि नहीं?
Ma'am.
यस, इट इज एन इन्फ्लेमेशन. वहाँ पे इन्फ्लेमेशन होता है. ठीक है? Okay. Okay, next, Darshana.
Yes, ma'am.
Okay, Darshana, can you tell me in which part of the vein this the vein sorry, not the vein, superficial thrombosis usually occurs? In which vein?
Ma'am, say again, ma'am.
In which part of the vein superficial thrombophlebitis occurs? You have got two veins, na? Superficial and deep veins. So in which part of the vein superficial thrombophlebitis occurs?
Superficial.
Superficial what?
Um,
Superficial
Thrombophlebitis
vein. You should say vein. Okay.
in
Hmm.
superficial.
Okay, superficial vein. Okay, next, Dibyajit Sakya.
Yes, ma'am.
Okay, ये superficial thrombophlebitis कौन सा पार्ट में ज्यादातर अफेक्ट करता है?
Mm,
हाथ पे, पैर पे, कहाँ पे?
ma'am, leg.
Okay, leg. Okay, also known as limb or extremities. Okay.
Yes, ma'am.
Okay, next, Gem Nunu.
Yes, ma'am.
Okay, can you tell me any symptoms, Gem?
Blood clot.
Symptoms. Obviously blood clot होता है लेकिन ये तो blood clot होने के कारण मतलब क्या क्या चेंजेस आता है पैर पे मतलब क्या दिखने को मिलता है?
Swelling होता है.
Okay, anything else?
Swelling.
Swelling. Okay.
Tenderness.
Okay.
Warm.
Warmth. Okay, good. Okay, next, Hemam Shelly Devi. Can you hear me, Hemam?
Yes, ma'am.
Okay, so the veins, it becomes hard or soft because of
Hard,
this
ma'am.
hard. Okay, anything else you want to add?
Mm, Darkening.
Okay. Why? Because of the blood clot, no? Because of the blood clot, the color also changes. All right. Okay, next. Okay, good. Next, Ilashra.
Yes, ma'am.
Okay, can you tell me the causes of superficial thrombophlebitis?
Chronic issues.
Okay,
Smoke.
smoking. Okay,
Medications.
what?
Medications.
Medications. Okay,
The obesity.
immobility. No?
Is
Okay, okay, good.
obesity.
Okay, good. Next, Ishan.
Yes, ma'am.
Okay, can you tell me the risk factors? Not all, like whatever you remember.
Sitting for
Mm-hmm. What can be the risk factors?
ma'am, sitting for too long.
Okay, sitting for too long. Anything else? I forgot to say one point, like previously, like if a person will have thrombophlebitis in the previous case also, no, like that particular person will be again at the risk of having this superficial thrombophlebitis. All right, I forgot to mention that part. Okay, anything else, Ishan?
Overweight.
Overweight, obesity, no?
Yes, ma'am.
Okay. Okay then. Okay. Next, YCOM.
Yes, ma'am.
Okay, YCOM, can you tell me the prevention? How can we prevent ourselves?
We need to take a walk.
We need to take a walk. Okay, next, Mercy.
Hello?
Yes, YCOM, it's okay. YCOM and Ishan, you can mute yourself. You can mute yourself, Ishan and YCOM. It's okay. Ishan, you can mute yourself. Okay, Mercy, can you hear me, Mercy?
Yes, ma'am.
Okay, can you tell me prevention part?
Yes, ma'am. Uh, by drinking plenty of water to avoid dehydration,
Okay, okay,
to
good.
move the legs regularly, to take
Mm-hmm.
a walk,
Okay,
and if we travel for long journey like in flight or while driving, we should
mm-hmm.
stop at least after an hour or two to move the legs
Okay,
to prevent having blood clot.
okay, good. Okay then. I hope every one of you understood now superficial thrombophlebitis. Do you understand? Everyone?
Mm.
Yes or no?
Yes, ma'am.
To whomever I didn't ask also like I hope okay then. Okay, shall we end the class then with this? Shall we end?
Yes.
Okay. Okay then let's end the class with this. Tomorrow again we will be revising on the another topic.